Hi, Frank Leonard. We'll be speaking to you about physician-assisted suicide. The pro on physician-assisted suicide. Physician-assisted suicide. Physician-assisted suicide is a very controversial, complicated matter that is often polarized, that has often polarized the voting public. On one hand, there are those who believe that patients suffering from chronic illness and fatal illness should be allowed to die with dignity, on their own terms and in peace. A bit of a background information. The definition of physician-assisted suicide is the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. Physician-assisted suicide is the practice of providing a competent patient with a prescription for medication for the patient to use with the primary intention of ending his or her own life. In 1997, the United States Supreme Court ruled that the Constitution neither permits nor prohibits physician-assisted suicide. In the same year, the state of Oregon became the first state to legalize assisted suicide. Reason why I agree with physician-assisted suicide. The first reason is the terminal ill patient right. Let's look at the legal right for the patient. Do terminally ill patients have a legal right to a physician-assisted suicide? In Morris versus New Mexico, the New Mexico 2nd Judicial District in January 13th of 2014, which was just last year, ruled by Judge Nan Nash stated, the court therefore declares that the liberty, safety, and happiness interests of a competent, word again, terminally ill patient to choose aid in dying is a fundamental right under the New Mexico Constitution. So yes, a terminally ill patient have a legal right to request the assistance of a doctor to assist them in ending their life. Reason 2, the physician obligation. Physicians have an obligation to relieve pain and suffering and to promote the dignity of dying patients in their care. To promote the dignity of dying patients in their care. Accordingly, physicians are only allowed to prescribe legal medication in jurisdictions where it is legal, regardless of what the patient wants or the prognosis of their disease. Since the Oregon Death with Dignity Act was enacted in 1997, more than 1,100 people have obtained life-ending prescription, and about 750 of those have used them. Most were dying of cancer and feared the loss of dignity, autonomy, and decreasing ability to participate in activities that made life enjoyable. What this is saying to me is approximately 75% actually went through with terminating their life. They got the medication from the doctor, the prescription, and they actually did it. 75%. That's more than half. Reason number 3, the obligation to humanity. The American Civil Liberty Union of Florida has argued in its October 29th 2003 petitioner's brief in the Terry Savolvo case, we all die, it states, we all die, but in age of increasing longevity and medical advance, death can be suspended, sometimes indefinitely, and no longer slips according to its own unchangeable timetable. So for both the patient and their loved ones, real decisions are demanding. When do we stop doing all that we can do? When do we withhold with therapy and allow nature to take its course? When are we, through our own indecisions and fear of morality, allowing wondrous medical method to prolong the dying rather than the living? In closing, we ourselves have an obligation to relieve the suffering of our fellow human beings and to respect their dignity. Lying in our hospitals today are people affected with painful, excruciating pain and terminal conditions and diseases that have left them permanently incapable of functioning in any dignified human fashion. All persons have a moral right to choose freely what they will do with their lives, as long as they inflict no harm on others. This right of free choice includes the right to end one's own life when one chooses. Having a doctor assist them with ending their own life allows them to stop this suffering and assure them that death will be on their own terms. So I say to you, what is life if you cannot die with dignity? Thank you.